The following presentation is a recording of the Adrenal Alternatives Foundation's Advocacy Town Hall, recorded in spring of 2021 as representatives for the Rare Disease Congressional Caucus. So we have a small presentation just to explain what we're going to be doing. As I previously stated, we are with Adrenal Alternatives Foundation, which is a 501c3 organization dedicated to education, advocacy, and encouragement for all adrenal disease. And we were very excited to be accepted into the congressional caucus, which basically a caucus is kind of a fancy word for a meeting that involves our legislatures, and they have graciously invited a lot of nonprofit organizations to be a part of the legislature to help make these decisions. And we proudly serve on the COVID-19 response, healthcare access, and public policy committees. So this afternoon, we're going to be explaining kind of what we're doing, and we're excited to share this with you. So as I previously mentioned, the adrenal advocacy is why we're here, and that's what we're doing. And these are the current advocacy efforts that we are currently supporting. So we are in support of the STAT Act. We are supporting COVID-19 rights and also the expansion of SB 730, which is the No Patient Left Alone Act. And I'll explain all of these things in detail. So the first thing that I want to explain is the STAT Act. So the STAT Act was just recently introduced this past month, and it stands for Speeding Therapy. So the STAT Act will improve rare disease coordination, stakeholder engagement, and policy development within the FDA by expanding existing authority to create Rare Disease Center of Excellence. So that's a bunch of fancy terms, but what is it? So the STAT Act will accelerate rare disease therapy development. It will optimize coordination, and it will help us basically create more integration that will provide us with rare disease options. As most of you know, a heavy part of what we do with the foundation is we are involved in cortisol pumping advocacy, which is an alternative treatment that is life-saving for those who have failed to stabilize on oral steroid therapy. And so the STAT Act is really beneficial to us because it helps facilitate access to therapies. So like I said, how does it impact us? How does it benefit us? So the adrenal community can be benefited by the STAT Act, which ensures healthcare access in a timely manner to those needing FDA approval for treatments and healthcare needs. Specifically, the cortisol pump method is not yet FDA approved, and this act can provide a gateway to FDA approval for this life-saving treatment. So how are we going to support it? Providing congressional reps with documentation that outlines the cortisol pump method and how we need expedited FDA approval of that treatment, and also an ICD-10 code assigned to this life-saving treatment. So basically what we've done is in our congressional meetings, we have met with multiple representatives, and we have presented them with they call them one-pagers. And we presented them with this document that explains what the cortisol pump is, what it does, and why it's necessary, and why we need FDA approval on it. This document is available on our website, and you can download it and send it to your local representatives. Like we said, the support of the STAT Act is very beneficial to our community, but not only us, also other rare diseases that are seeking treatments. Quality of life is definitely something that is an issue with chronic illness, and this act will facilitate helping to get better treatments for rare diseases. So we definitely support the STAT Act. And again, this document regarding the cortisol pump can be downloaded, and you can send it to your own representatives. And also information on the STAT Act we have posted on our website and our Facebook and our social media. So if you want any information on that, we can certainly get that to you. And we highly, highly recommend that you print this cortisol pump document and send it to your representatives. So that is the STAT Act, and that is the first thing that we're really supporting. The second thing is the COVID-19 rights. COVID-19 regulations have been a major issue for a lot of people with chronic illness, and it seems like the regulations have taken the humanity out of healthcare. So many chronically ill patients have been told they cannot have a caregiver present during medical events such as doctor appointments, procedures, and even some surgeries. So this is a big issue that has just recently come about with the COVID pandemic. So we are really involved in making sure that people know their rights. So legally, no medical facility can deny a disabled person's right to a caregiver or patient advocate be present, even during the COVID pandemic. So we're finding that there's really no standard set for different medical facilities. Every doctor's office seems to have their own rules on who can have visitors, who cannot, even some hospital systems and, even long-term care facilities. So what we're finding is that even disabled people are being told that they can't have a caregiver present, and that's actually really not correct. So for disabled patients, having a caregiver present during medical events such as procedures, testing, treatments, doctor's appointments, and surgeries is an American right. So it's really important to know that that is a right and there are protections. In the United States, there are legal mandates that state medical centers must follow existing guidelines in the Americans with Disabilities Act, the Rehabilitation Act, and the Patient Protection and Affordable Care Act. So what we've done to support this is we have created a QR code that you can scan should a medical facility deny you your rights. So for example, let's say that you have an adrenal insufficient family member and you go into the emergency room and they tell you, no, you cannot go with them. You would scan this QR code and it will link you to all of these, the previously mentioned mandates. So like I said, this falls under the category for those that have been declared disabled. And we'll get into that, how we're going to advocate for everyone chronically ill to be able to have this. But these mandates specifically are set up for those who have been declared disabled. And so legally, if you have been declared disabled, they cannot deny your right to have a patient advocate or caregiver with you. So we're really trying to educate people that in the United States, these COVID mandates, we understand why they're there. And, of course, if you can go without a caregiver, that's what's recommended. But those of us who cannot, specifically those in adrenal crises and things like that, we have created this QR code so that you can stand up and say, hey, these are my rights. This person is disabled. I need to be with them. So that's, again, available on our website. If you go to the COVID rights tab, it will lead you right to the QR code. You can save it on your phone and it will be available to you. So we have been very diligent in making sure that people know their rights. So that is the COVID-19 regulations that we're working on. Expanding on that, like we mentioned, the previously mentioned things are for those who have been declared disabled. And I know that there are some that are awaiting their disability decisions and those who have not yet filed. And so where does that leave you guys in terms of having caregivers with you? So there's a bill called the No Patient Left Alone Act that was passed in North Carolina, SB 730. And this bill is legislation that mandates chronically ill patients are to have a caregiver with them during medical procedures, treatments, and surgeries, even during the pandemic. So how does this impact adrenal patients? So the concern, like we mentioned, is that the increased potential for patient endangerment and medical errors in patients with rare diseases, such as treating an adrenal crisis without caregivers and advocates present, is of great concern not only to adrenal patients and caregivers, but to medical professionals as well. For example, a lot of us that are involved with adrenal alternatives are cortisol pumpers. And should we go into an emergent situation without a caregiver, the hospital staff really probably isn't going to know what to do as far as cortisol pumping protocol care, whatever goes, because it's such an unknown, even within the endocrine community. So we are very concerned about the increased potential for medical errors. That does not stand only for adrenal insufficiency pumpers, but it stands for, pretty much anybody with critical health issues that are not well known. So what are we doing about it? So we are proposing a standard protocol outlined in a legislative bill that will mandate nationwide protocols that allow chronically ill patients to have a caregiver with them during medical procedures and treatments. We have co-sponsored a petition that supports the expansion of SB 730, and we will present it to the congressional caucus. So we ask that everyone please consider signing the petition. Again, it's available on our website, which is adrenalalternatives.com. We have co-sponsored this with a number of other organizations. And like we said, it's really imperative that caregivers and patient advocates be present because there is an increased risk for medical errors. And it's truly not only, an error issue, but a humanitarian issue. I don't care how old you are, a medical situation is scary. And, even if it's not a surgery or an emergent situation, even doctor's appointments can be intimidating. And we might not always be able to be absorbent of all the information. When you go into a doctor's appointment, it's usually, 15 minutes tops, and there's a lot of conversation between them. And usually it helps to have a caregiver present so that you can kind of glean that information. And caregivers are essential to the management of a chronic illness. So we ask that you please consider signing this petition, again, available on our website, adrenalalternatives.com. So that's just kind of an overview about what we're doing as far as advocacy within the congressional caucus. And we would be glad to hear whatever concerns that you have. We are on the COVID-19 response committee. We are on the healthcare access committee and the public policy committee. So we are really trying to get our voices out there and be present in the legislate in order to represent the adrenal community. Our voices are definitely being heard, and we are encouraged to know that the STAT Act has had very positive acceptance so far. It is sponsored by the Every Life Foundation, which we're affiliates with and very thankful for. So if you would be so kind as to consider, signing the petitions and supporting the work that we are doing. We do this because we care about the adrenal community, and truly our voices need to be heard. Specifically, with the STAT Act, we are very supportive of that, because if that would give us a voice, within FDA approval and things like that. So for more information, you can visit our website, which is adrenalalternatives.com, or you can sign up for our email list. We do send bi-monthly updates on what we're doing and things like that. And it is Adrenal Awareness Month. So throughout this month, we're going to be doing some different events. So thank you for tuning in to the Adrenal Advocates Town Hall. And if there's any information that you have, any stories, any concerns, anything that you would like for us to take to Washington, D.C., we are definitely receptive of that. You can send us an email at adrenalalternatives@gmail.com. So we thank you for tuning in. Again, this has been the Adrenal Advocacy Town Hall with your host, Adrenal Alternatives Foundation. Thank you. This content has been brought to you by the Adrenal Alternatives Foundation, a 501c3 nonprofit organization dedicated to education, encouragement, and advocacy for all adrenal disease. For more information, please visit our website, adrenalalternatives.com, or visit our social media.